Alright, so here we are at the end of January, which actually took a very long time to get to. Very long month. I got unbanned from my little copyright strike thing that started in October. And I've basically the whole time been working on how to continue being able to help you guys without really hitting any copyright strikes, right? So what we see on my screen right now is my Discord server. And in this video, what I'm basically going to do for you guys is break down, we're going to talk about my Discord course, which is right here on the screen. We're going to talk about the various YouTube high-yield videos I'll be making to try to help you guys out, what kind of videos I'm going to be doing in the future from here onwards, because they won't be similar to what I've been doing in the past. And then I'm going to give you guys some perfect study tips in the same video, right? So when I'm done with this video and I start editing it, I'm going to timestamp it at the bottom so you can see where to jump to if you just need like high-yield advice or like study tips and what to do, etc., etc. So the Discord course itself is basically where I personally work with a set number of students, right? So right now this server on this app called Discord has 274 people that are offline and 13 that are online, so almost 300 people in this community right now. And in this community, you know, there's a bunch of rooms on the left side where people can just, you know, go in and talk about whatever they want to. So you can see like some of them are having, you know, people having conversations about trying to get together to study and stuff like that. And then the ones you see on the top, the VIP CK room and the VIP Step 1 room, and the people whose names are pink on the right side, those are the people that are part of the course, right? So those people that are part of the course, they're able to join those rooms, and then we work together and study on stuff collectively, right? So I meet with these people at different times throughout the week at set schedules, and then we talk about everything they would need, go into first aid, go in depth with all the topics, review how to tackle questions and stuff like that, similar to what we used to do in my original videos back in the day. This has basically been the most successful thing lately, and it has been beyond helpful to everyone that's been a part of this community. So this Discord course is something that you can always reach out to me for, shoot me a quick email, and then we can dive right into that and set you guys up, anyone that's interested in joining. Other than that, from here on, when I'm making videos starting from February basically, these videos are going to be different primarily because I'm not going to be able to have anything on the screen, right? So that's the number one thing. One of the primary issues that had presented originally was the issue that I had copyright materials on the screen, namely the sketchy micro images or UWORLD questions, stuff like that. What's up, guys? Good to have you here. Mona is asking, will this be saved later? Yes, it'll be there. This video will be on my channel to watch later as well. Excuse me. So that being said, you know, I can't really have anything on the screen, but what we can do is I sell my notes, right? So if you guys want to buy my study notes, again, my email is going to be at the bottom of this video when it's posted. You can always reach out to me, purchase my notes, and then follow along with whatever I'm talking about, right? Because I can talk about anything I want to. That doesn't audit any of their copyright problems that they brought up previously. But I can't have it on the screen. So that's one issue basically resolved. Now comes the problem of what will I be talking about. So if I just open up like first aid right here, right? So there's a lot in step 1, right? And right here we have first aid 2021, which really isn't that much more different than first aid 2020. And compared to my own annotated notes that I had, first aid 2021, basically I already had everything that's in this in my own annotated version. So again, having my notes is extremely helpful because of the way it's built. My book, that thing has everything in such a well orchestrated manner that when you go through it from top to beginning to end, you pretty much grab everything you would need, and then there's really not much left to study. And one of the beauties of being part of the course, or really just being part of my videos, is that a lot of students told me this one thing that I found was kind of, you know, it's a little creepy, but it works out for them, which was that during the test, they often hear my voice explaining something and say they were doing a question on maybe biochem metabolism, and the question was about F26 BPAs and how that regulates glycolysis. They would hear something I might have said in one of my videos, and it just sticks to them, and then they would get it right? So that kind of guidance and getting such a question correct just because you could recall something so simple, even though it's very complicated for many people, is a priceless thing. So that's an amazing thing. Now, first aid itself has many things to look at, and one of the things that I'll be doing in my videos from here onwards is just every day I'll go live for whatever amount of time, making multiple about 10 to 15 minute videos, multiple 10 to 15 minute videos, where each video is going to be about one specific topic, right? So for example, I can make a video right now about congenital adrenal hyperplasias, right? That's a very specific topic, enzyme deficiencies that cause various kinds of congenital adrenal hyperplasias to occur because you make more ACTH. I can delve into the entire topic, break it down, and then show you how to get different questions correct without being confused between the three and how to remember them perfectly. Then another video would be the various types of urinary incontinences, how to differentiate them from each other, how to know them perfectly, how to understand the various treatments that are allocated to each one, right? Stuff like that. That's basically what the bulk of these videos are gonna be. But at the same time, if you have my annotated notes with you that I can't have on the screen, then you can open up the notes on your own screen, right, on your own computer, and follow along with whatever I'm saying. Because oftentimes what I'll do is I'll give page references, right? So I'll be like, okay, if you look at page 13 or page 700, etc., you can jump to that page and look at what I'm basically talking about. But I can't really have it on the screen for obvious reasons. So that's going to be the bulk of the videos I'll be doing from here on. But in the last 3 to 4 months where I haven't been able to live stream because of the copyright bans that occurred, one of the most frequently asked questions were study advice questions, right? What should I do to master X, Y, and Z, right? And then so on and so on. Now, mastering each one of these different things, each one of these organ systems and each one of the principles is a whole different variety of topics, right? So right here, starting at basically the 7-minute mark, I'm going to dive into like how to get your study perfected. The number one advice I'm going to give for that is to not spread yourself thin on too many different resources, right? People use Pathoma, UWORLD, AMBOSS, First Aid, and then start delving into other resources like Robin's Pathology or Dr. Najib's videos and so on and so on. And the more resources you try to visit, the more books and videos you try to read and watch, the less you actually grasp. So here's the thing, the more times you repeat the same resources, the better you understand that resource, right? So what I want to say is that, the first time you read through First Aid, the first time you even read through a couple pages of maybe one topic, like let's say it's your first time going through biochem nutrition and you read a couple things about vitamin A deficiency, not all of it is going to stick to you. So one of the things you want to do after you read a topic, which is basically the bolded thing of each thing, right? Vitamin A, then you read all the vitamin A stuff, then vitamin E, you read all the vitamin E stuff. Each of those topics, that's a topic right there. As you're reading them, you finish those topics, you want to make a list. Okay, I read today about X, Y, and Z, right? Then you should be able to close the book and repeat to yourself what it was you read. What were the key things you grasped? What were the key things you're going to look for in questions? What are some things you're going to try to watch out for, right? Because, for example, in nutrition, you know that vitamin B12 deficiency and vitamin E deficiency can both have certain neurological deficits. How are you going to differentiate? What was the one thing that was different between the subacute combined degeneration versus the little bit of neurological deficit you get in the other, right? You will really want to have that down to a T, because those little minuscule differences are really going to be all you're going to have to be able to pick one answer over the other. Now, revisiting the same topic in another book, or looking at it maybe in like Crush Step 1 or Step Up to Step 1 and so on, other texts that are out there, is really not beneficial for you. Because the point is to memorize and know something that your brain can recall when you read the question, right? So if you read a question about vitamin E, you should be able to have some kind of visual recall of the page in First Aid where you read about vitamin E deficiency and excess and so on. The other topics that are on the same page, because oftentimes that's a relevant thing. And then what you saw in terms of images that there might have been in the book, right? For example, with zinc deficiency, there's that acrodermatitis image that should come to mind. And when you see that image in your mind, you can think of that in your question, right? Where you might have a patient with some weird dermatitis, and the question all of a sudden shifts gears to asking about some kind of deficiency, right? Mineral deficiency. So stick to one resource. Stick to one resource. The more times you can reread first aid, and the better you can get at memorizing it and be able to repeat topics without the book in front of you, that's when you know you're ready for step one, right? Like, you should be able to sit there and talk about, for example, it's two different things. First of all, the principles and the organ systems are completely different things. Step one really likes asking questions about the principles. Oftentimes, they'll start a question off with something organ system related, like GIT, right? And then all of a sudden shift gears to a question that becomes all about hyperammonemia and the urea cycle from biochemistry. Step one loves that. The reason being because CK doesn't really have much biochemistry at all. They won't really be asking you about certain fat degradation enzymes or malonyl-CoA from lipid breakdown, any of that. That's not going to be popping up in CK per se. Can it? Yeah, sure, but it's not a thing. It really won't happen. You can rest assured. You can get a question about some kind of autoimmune problem, some kind of immunodeficiency problem, and then all of a sudden the question shifts gears to asking about an immunology topic regarding some kind of cytokine or some kind of T cell differentiation, interleukins, etc. So you need to spend ample time being able to read the same topics from the same book and then revise those topics without the book in front of you. Right? You should be able to sit down and draw out the T cell differentiation table. And with my memorization tools in my book, I have these memorization tools I made up just for being able to recall things without the book in front of you, because of course you won't have it there on the day of your test, for how the T cells differentiate, right? Because interleukin 2 and interleukin 12 give you different things. Interleukin 12 starts with the number 1, so it gives you Th1 cells. Interleukin 2 and 4 give you Th2 cells. That memorization tool was something I put into my annotated book when I was studying for this so that I could remember this without the book in front of you. Right? And that's usually a very hard question that all of a sudden became super easy now just because you have this tool. Right? You could literally get a question of which interleukin would you need to get Th2 cells, and then if you don't remember, you can't do anything about it. Right? Because that's how medicine is. Being a math major myself, that was something that I always hated about pretty much any other topic besides math, right? Because in math, you don't need to remember it. You can literally deduce an answer and check it by plugging it back in and whatever, right? But in medicine, it's just about, do you remember this? If you don't remember it, you're just going to get it wrong. You can guess, and that's it. So that always sucks, right? So that's one thing. That's one advice. Stick to one resource and revise things without the book in front of you so that whatever it is you cannot remember, whatever tiny detail you couldn't revise, you go check again. And when you go check it again, it sticks to you better. Second advice, start breaking down the key, most high-yield topics for each organ system and keep a tab on that page so you can just jump to it, right? You should be able to right away jump to it. For example, in cardiovascular pathology, there are a lot of things, right? In cardiovascular anatomy, there's a lot of things. So cardiovascular is one of the biggest organ system chapters, and you really want to spend a lot of time going through it. You need to make sure from top to bottom, without even really opening the book and going to specific pages, you should remember the anatomy of blood flow, neonatal versus before and after birth, basically, right? The changes that occur with the 3 different shunts, why they're there, how to memorize them perfectly, the differences in oxygen pressure, etc. Then you go into the physiology of maneuvers. Why do certain maneuvers, cardiac maneuvers, actually change certain heart sounds? I break that down perfectly in my notes, and I also have spoken about it in videos before. And when I get to that chapter in my newer upcoming videos, I'll do that too. I'll have one video dedicated just to talking about the various maneuvers and why it is that certain maneuvers cause certain changes with various, if you have mitral regurgitation, what makes it louder, what makes it softer, and so on. You should be able to talk about that. That's when you know you're done with that topic. You don't need to worry about it anymore, right? The next thing, the various types of things that are related to heart failure, right? The fact that you have to ramp up your entire renin-angiotensin-aldosterone system, the fact that you have to ramp up your beta activity, right? All these things that occur while it's still decompensated heart failure. Then it becomes compensated heart failure where you're done with the remodeling, but it just so happens that all that remodeling is very pathological and ends up causing more problems, right? But you got to be able to talk about it because you're going to get questions where they're going to ask you, oh, this is a patient presenting with X, Y, and Z heart failure symptoms. What's going to happen to this patient? in terms of renal, in terms of respiratory, in terms of whatever, right? Blood is going to back up into the lungs. They're going to have fluid in their lungs, whatever, right? So I'm going to have specific videos coming from here on, starting in February, for each topic. And each video is going to be about 10-15 minutes. That way you guys can have the specific videos you need for whatever topic you're struggling with and master it, right? Previously I had continuous videos where I was basically talking about, whatever I could fit in that time period, and then I would keep going. But if you needed a video on just heart failure, you had to find it. And I get that that was a little annoying for many people. So, I'm going to have specific videos for each chapter. Your exam is next month. Best of luck with that. Best of luck with that. I'm going to get to that too, what to do a month before. That was another topic that I was asked. So advice number 1 is done. Advice number 2 right now, what I'm saying is the breaking down, right? Breaking down the topic. So in cardiovascular, what should you have tabbed? You should have tabbed, like I do right here. So let me see. With cardiovascular has so many topics I haven't tabbed anything actually. But what you could tab is the heart failure page. Just that heart failure page itself. So that all you would have to do is click on that one button and it leads you right to the heart failure page. Right? And then you could go ahead and study it. Now moving on, you see how in each section I have something specific tabbed. Look at this. In endocrine, I've tabbed congenital adrenal hyperplasias because every time I ever feel like I can do this method of shock studying where I can just jump to a topic and study it, even though today I might be studying something else like GIT, it helps, right? So what is shock studying? Shock studying means that today, maybe you're going to spend all your day today studying respiratory, right? But you could shock your mind by suddenly shifting gears to just going back to congenital adrenal hyperplasias and mastering that one more time and then continuing on with your study. Right? That's what shock study basically is. This is important in terms of creating a field where you're not bored, right? Because if you just read the same thing over and over, or if you just keep going on the same topic, eventually you just start losing focus and start losing motivation, and it just gets boring and dull and you can't do anything about it. So shock studying is nice because you could jump from one topic to the other just by clicking on the topic right now, and boom, congenital adrenal hyperplasia shows up, right? So this is nice because when you could do stuff like that, when you can just jump around from one chapter to another, you're good to go. That really helps, okay? So you're going to need to do that for each one. So for example, you keep going in gastrointestinal, you really need to be able to break down Crohn's versus ulcerative colitis, right? You get to hematology, you need to remember the translocations of each of the chromosomal disorders, the different types of leukemias and lymphomas that occur. Right, in musculoskeletal, you're going to need to know the upper and lower extremity nerves and blood vessels, of course. But one of the most notorious pathologies is the osteoarthritis versus rheumatoid arthritis, how to differentiate between them, right? When you get to neurology, one of the most notorious topics there is the neurocutaneous disorders. Your VHL, NF1, NF2, Sturge-Weber syndrome, all of those guys, because those guys have this collection of presentations that are very non-specific, and when you see certain things happening in the same person, it gives it away what the diagnosis might be, right? So if someone has glaucoma and epilepsy, that makes you think of Sturge-Weber, and then you're going to think that maybe they have the tram tract calcification in the brain, and they might have half their face marred because of the cranial nerve distribution, and so on, right? You need to keep revisiting these pages to have a mastery of that, though. When you get to psychiatry, you need to know your psychiatric emergencies, which often look so similar to each other. You're going to get these patients with questions regarding their pupils being dilated or pupils being constricted, and then how is that relevant to anything? You need to understand that a pupil being dilated or constricted is relevant to sympathetic versus parasympathetic activity, that when you're ready to fight someone, you literally dilate your pupils so you can see everything. That's fight or flight, that's sympathetic activity. Right, so pupils being dilated means that someone took something that really made them go into sympathetic mode for whatever reason. In renal, you're going to need to have a good understanding of your acid-base physiology, which is very high yield, understanding the fact that, why do certain electrolyte imbalances occur the way they occur, right? So when people lose hydrogen, you actually end up, losing your potassium too at the same time. Oftentimes that's going to be a thing that you have to make sure you know. So when you get to, for example, in endocrine, when you get to, let's see, which one was that? Addison disease, right? When you get to adrenal insufficiency, for example, In Addison disease, you don't have the ability to make aldosterone or cortisol. So when you don't have aldosterone, you lose sodium. When you lose sodium, you actually retain hydrogen and potassium. Why? Because in the kidney, there's a hydrogen and potassium co-transporter, where they move together. Right? So you lose sodium, you retain potassium, and you end up retaining hydrogen. And you could see that in renal physiology, where they have the little nephron portions and they tell you what each portion does, and they have all the channels drawn out. Similarly, at the same time, so you lost sodium, you retained hydrogen and potassium. Okay, what else is going to happen? Well, if you retain hydrogen, you have to lose bicarb. Now that's considered metabolic acidosis. When you lose bicarb, the PCT in the kidney, the proximal convoluted tubule of the kidney, has a basolateral chloride bicarb exchanger. So when you lose bicarb, you retain chloride also. This entire concept of knowing that plays a huge role in acid-base physiology. This is why it's in renal, because acid-base physiology, for the most part, is managed by your kidneys. Right? Even the respiratory acidosis and alkalosis are managed by your kidneys, because your kidneys are going to try to compensate. Right? But the respiratory issues, any respiratory issues, take time to compensate, because your kidneys have to take time to see the issue and then change things. But if you have a metabolic issue, you can immediately just start breathing really, really quick or breathe really, really slow based off of whatever the problem is. And again, when you start having that mastery of topics, which I really incorporated in my notes, you become very comfortable. You understand what's happening. You don't have to be confused or have to remember anything. And you want to revisit acid-base physiology over and over every time you do a question where the question is about acid-base physiology. If the question is about whether a patient has metabolic acidosis, alkalosis, respiratory, blah, blah, you need to be able to get that down. And then, even after you master that, comes the next step of mastering mixed acidosis and alkalosis and so on. Or is it concurrent acidosis from respiratory and metabolic, right? Has it been compensated for? That's another thing you have to get a mastery of. And then you can start comparing different questions with each other, right? So do all those questions. Every time you get a question like that, you should be able to jump to this page without much hassle. You just click on acid-base physiology and boom, you're there, right? So you want to have that bookmarked on your text. The other stuff, urinary incontinence, which is also in renal. You don't want to have any confusion when you get a question on urinary incontinences. First of all, it's not even urinary incontinence if there isn't dripping. Right? So if they don't mention any dripping, you should keep your mind open to the fact that it might just be some other issue, like maybe it's a person with benign prostatic hyperplasia. That can also make it difficult to urinate. Right? Urinary incontinence means that you don't have the continence. Continence is the ability to not just go pee just because you have urine in you. Right? Kids, infants will just urinate because they don't have this mentality of being continent. Right? But as adults, we can hold our urination. So incontinence is the inability to hold your urination, where it just starts dripping. Okay? And you have to know the differences between the three types: stress, urge, whatever the others are, right? And then how to treat them. And how to treat them really depends on knowing the various receptors that are there, which kinds of medications you can use, and so on. So you got to bookmark all of these notes. The last thing, reproductive, very difficult chapter. Right? Very difficult chapter. In reproductive, you have so many things involving various cancers in the breast, ovaries, uterine. It's too much, right? You need to break that down and spend time visiting each thing individually. So in my book, so I'm not blocking it anymore, I have it labeled as vaginal pathology, breast pathology, and penile pathology. So I can just jump to it by clicking on it and revise it as a shock study kind of thing. Right? Today might have been a day where I'm going to be studying psychiatry, but all of a sudden I can just jump to vaginal pathology, look at all the different vaginal pathologies, and now come back to psych. So this was like a mixed advice, right? It was a mixed advice of doing shock studies and also labeling your book in such a way that you can jump to topics. People are asking the difference in FA 2021. So First Aid 2021, the only new thing compared to First Aid 2020 is that they have some new images. I've gone through the book. They have some brand new pictures here and there, some drawings they made, but really not anything fancy. Really not anything fancy. Those pictures were there in UWORLD already, or you've already seen it somewhere else. Like if you Google topics, we should always be Googling topics if you don't have proficiency on them. So yeah, don't stay on First Aid 2019. My annotated book, the First Aid 2019 that you're seeing here, this has topics from First Aid 2020 already. I moved it all into here. And then I'm going to go through First Aid 2021 and grab anything else and move it into here too so that it's updated. And then I'll just rewrite this as First Aid 2021 because it's going to have everything that's in First Aid 2021. So that's basically it. Rather than annotating an entire brand new book that's blank, that would take forever. And it's pointless, really. So I can just move all the new things from First Aid 2021 into my annotated book. And then if you are interested in buying any of my notes, you can always just shoot me an email and we could talk about that. Third advice here right now is that when you're doing questions, when you're doing UWORLD, AMBOSS, whatever it is you're doing, and hear me out before you get shocked about it, but when you do Q-banks, like you just started doing Q-banks, cheat. You should be cheating when you're doing questions. Trust me, you haven't tried it yet, then you need to try it first and then you'll see. So what do I mean by cheat? Okay, let's say you're on a UWORLD question right now, you read the question and then you have a pretty good idea what the question is about. Maybe the question is actually about heart failure and how it connects to the kidney, activating renin-angiotensin. Then you look at your answer choices, and the answer choices might be some confusing things related to the kidney, right? Maybe they'll ask you about angiotensin 1 becoming angiotensin 2 and then causing vasoconstriction, something along those lines. Or maybe it's about the physiology of how vasoconstriction even helps a patient who has heart failure, right? And you see two answer choices. Happens all the time, right? You see two answer choices that you think are both possibly correct. Great. Okay. Now comes time to cheat. You might be confused between choices B and C. Be honest to yourself and tell yourself you're going to put whatever you think you're going to put. Maybe you think you're going to put B. Now, open up First Aid, go to First Aid, look at that topic of heart failure, and then look at the topic of the RAS system, renin-angiotensin, and perfectly understand the topic that your question is about. And now, once you know that, come back and see if it was B. And if it was B, then great. Pat yourself on the shoulder, lock it in, and move on. If it wasn't, if it was C, still pat yourself on the shoulder because now you did the research to know the topic, understand the topic, and see where you were wrong in your thinking, where you made a mistake in your understanding. Lock in C, read the explanation, make sure you now know everything you're seeing in the explanation, and move forward. This methodology is much more impactful than creating a 40-question Q-bank and then answering all the questions, then coming back to revise it. First of all, answering 40 questions sucks. It's very tiring, it's very draining, it's very boring, right? And if you ever fall into a loop where you just answered 4 to 5 questions wrong back to back, you get depressed. That mini depression hits pretty hard, and then it's just like, I don't want to do this anymore. And then imagine now, after finishing all 40 questions, you're going to take a little break and you're going to come back and go through all those 40 questions. It's draining. It's very draining. So if you look at the effort to benefit ratio, you put in a lot of effort. You went through possibly a lot of pain, especially if you got questions wrong, even though you were confident you would get it right. And you didn't really gain much. You're not going to gain much because now you're going to be in this position where you're upset. You never want that. You never want to be upset while studying. If you're doing practice questions and you get them wrong and you get upset and you revise things and you're pissed because the explanation was probably too simple and you actually are embarrassed that you got some of these wrong, you're not going to retain any of that. When you do the cheating method, not only do you actually get to revise a lot of the topics, you won't be getting questions wrong. Right? You won't be getting questions wrong. You might have actually gotten it wrong because you thought it was B, but the correct was C. But you learned it now. So you see how the effort was nice because you got to go back to First Aid, which of course the more times you revisit First Aid, the better you get at it. The better you retain the topics. And you got to look at the question and see where you were thinking incorrectly, where your gaps are, what it is. So all around, it's like doing research and actually studying. You need to do this so that on your test day, when you have the same question about heart failure and the connection to the renin-angiotensin system, in your mind, you'll be able to recall everything you just did. You'll be able to recall that you opened your book, you went to the heart failure page, you saw certain images. You'll be able to recall the weird-looking liver. In right heart failure, you'll be able to recall the weird looking lung x-rays because of left heart failure, and so on and so on. You'll be able to recall the diagram with the whole renin-angiotensin system, what's happening, why it's happening, the fact that there are beta receptors on your kidney as well. And then you'll be able to recall what you did when you went to a RAS page in renin, in the renal, in the kidney page, and you'll be able to recall everything that happened there. Then you'll answer the question correctly. So it's all about quality over quantity. Don't force yourself. You're going to hear all kinds of things from people, of course, because different things work for different people. Some people might say that you should be doing 100 to 200 questions a day. To me, that's preposterous, right? At that point, you're really focusing on quantity over quality. You should be able to do 200 questions a day, but that's when you're like a month away from the test. That means that by this point, if your test is coming up in a month, like someone said here, you should have pretty much amazing grasp of everything. All of this stuff. You're done. You're done studying. You're ready for your test. You're now just finally revising a few little things here and there, making ends meet, closing up any gaps, and you're done. At that point, yes, you should be able to answer 200 questions in one day because your test is going to be more than 200 questions in one day. But if you're new and you just started and you're like mastering topics and you're going from beginning to end, don't worry about answering a lot of questions in one day. The point is to have quality. You're going to read a question. You want to be able to break down the question, see what's happening in the question based off of the age of the patient, the presentation, the main symptoms that are actually bothering that patient, things in the question about any family history, right? Things about what their labs might look like or any imaging might look like, and then focusing on what really matters, not the extra stuff that's in the question that might be there to throw you off. And then look at the answer choices, see which one actually fits the presentation and labs that are given. Remember, the most important things are the presentation and the labs. Labs don't lie. Presentation can, but presentation also tells you a lot what's happening, but labs don't lie. Right? And labs don't lie is a big thing, because if you have a question where a patient is presenting with all these weird symptoms and you're not sure what's happening, and then you look at their labs or imaging, those things can't lie to you. When you see those things, that's when you know, oh, that's what the problem is, and you pick that correct answer choice and you move on. And step 1 and CK and most medical exams use this to confuse you. They're going to have this very confusing thing, big paragraph in the question stem, but then they'll give you some kind of key thing like the labs or some kind of x-ray, and that was actually the giveaway for the correct answer. But you were so lost in the big stem of things that happened in the question that you didn't see what happened in the actual imaging or labs. Labs don't lie, and that's a very important thing to remember. Always remember that, which I'm encompassing labs with imaging also. Labs and imaging both don't lie. Right? If you see it on an x-ray, it's there, even though they might not have symptoms. Very important to keep that in mind, okay? So those are my key advices for basically everyone that reached out, right? In your last month, 1 month before you're taking your test, all you should be doing is jumping to these bookmarked pages and making sure you have perfect understanding. You should be able to jump to psychiatric emergencies and break it down before you even read the book. Jump to congenital adrenal hyperplasia, break it down, know how to pick one answer over the other perfectly without even needing the book. There's no reason to be confused between 17 alpha hydroxylase deficiency and 21 alpha hydroxylase deficiency. They're very different from each other. Very, very different from each other. And how you're supposed to remember those differences is what I talk about in my videos and in my notes. So when we get there, we'll see that. I don't want to make this video too long with all that, but we're going to get there, and that's going to be what I'll be doing starting from tomorrow, February 1st. We're just going to be making videos that are going to be back-to-back videos of topic by topic to help you guys master that, all right? Once I'm done with this video, I'm going to label things in. I'm going to put my email and stuff in the description, and if you guys ever have anything you need, just feel free to shoot me an email. Give me some time to get back to you because I do get a lot. And then, let's get back to it, guys, and keep studying hard. Thank you very much for your endless support. I am very grateful for everyone that reached out to me after the copyright issues occurred. Very grateful to everyone that sent emails to the lawyers that were trying to get this channel shut. They did see your emails. They did reach back to me saying that they got thousands of emails from people that were saying to not do anything to the channel. They actually listened to your emails, okay? Because this channel was supposed to be deleted because it had too many copyright strikes. Of course, all the videos had copyright issues. but they didn't delete the channel, and that was actually thanks to you guys. So I'm very, very grateful for that. And you know, let's get back to it. Let's actually get some good non-copyright shit on the videos. And again, reach out to me if you want to buy my notes so you can follow along, or if you want to sign up for the Discord course, depending on when your exam is. It's a 3-month program, so that being, you know, in mind, you can shoot me an email to get more details on that. And then I guess that's it. You know, it's a good feeling. It feels really good to be back. It's very shocking. It was kind of feeling a little weird when I was about to click start streaming on my app, but you know, thank you very much.